there was a 30-year increase in median life expectancy during the 20th century, which is extraordinary. I mean, that's so much more than at any other time in our existence. And it also explains why we as a society don't know quite what to do with all these older folks. Okay, we've never had this before. We've had isolated people who live to 85, 100, 122, but not this many. So I think probably the biggest thing you can do is prepare your mind. It's your perspective on aging that really probably has more impact than anything else on how well you're going to age.
Hello, and welcome to Not Born Yesterday, a podcast dedicated to older adults and the challenges and joys of aging. I'm Miriam Goodman.
Not Born Yesterday is brought to you by Next Village SF, a local nonprofit providing older adults in the Northeast neighborhood of San Francisco with support to help age in place. I'm Lynn Winter-Gross.
While every episode of Not Born Yesterday is connected to aging, today we're dealing with honest aging. If you are like many of our listeners, you or an older loved one may confront a new ache or pain or health issue with the question, is this something new and serious, or is it just because I'm old? And if a professional tells you it's a result of aging, do you accept that and move on? Try to deny it and pretend it isn't affecting your life?
Dr. Rosanne Leipzig is an internationally recognized expert in geriatrics. She believes we can and should transform the way we approach aging. She sees patients, and she's a professor of medicine at the Icahn School of Medicine at Mount Sinai in New York. And she's author of a new book, Honest Aging, An Insider's Guide to the Second Half of Life. Her goal is a more engaged and meaningful life at every stage. Dr. Leipzig, welcome to Not Born Yesterday.
Thank you very much. It's great to be here.
So as producers of this podcast, we often tell people we meet about the subject of our podcast. And maybe it's not a surprise, but often people say, I don't want to hear about it. I don't want to know about aging. I'm doing it my way. I don't want to hear about it. So the subject of age right now is very big in the political scene. People are talking about it all the time. So how do you suggest we start that honest conversation about aging?
I think we have to start by saying aging begins at birth. We're all aging all the time. And if we're lucky, we will grow into old age. And the truth of the matter, which most people don't recognize, is that the vast majority of people live well into old age and they're doing pretty good.
So what is normal aging?
I think there are a lot of different definitions of it. My definition is it's what happens to almost everyone as they get older. It doesn't always happen in the same order. It doesn't always happen to the same degree. But it's things like walking more slowly, like suddenly finding that your arms are flabby and you got a little pot belly, okay? That you're waking up several times at night to go to the bathroom. And there are reasons for all of these, okay? But they happen to everybody as they get older.
So are there things that we should do to prepare ourselves for these so they don't come as such a surprise?
Well, I always I'm one of these people who divides the world in threes. The threes are not always equal, but 3 buckets. And I have found there's one bucket of people who want to be wise old owls as they get older, know what to expect, and be able to adapt to it even before it happens. Start thinking about it. I have a very dear friend who is always thinking, is this house going to be okay for us? And she just decided, okay, it's time for a continuing care community. All right. I'm like, why are you thinking about this already? But that she's thinking ahead. Then there's a group of people who learn all these things or hear all these things about aging, and they're just worried. Okay. I call them the worry warts. And they feel like all of this is going to happen to them and they don't know when and they don't know why, and they're scared. But the biggest group are the ostriches. They're the deniers and the people who this isn't going to happen to me. I'm going to be exactly as I am today, and then I'll be dead. And unfortunately, that happens to very few of us.
So what about falling? It seems like most of the people that I know that who are older either have fallen or are afraid of falling. Is it that we fall and then break a bone, or we break a bone and then fall, or how come we fall so much when we get older?
There are lots of reasons why we fall so much when we get older. And I'm laughing because I actually worked with somebody when I was first starting out in geriatrics who was of the opinion that the hip bone can break and then you fall, as well as you fall and break the hip bone. Both things can happen. And I think he's right. I think he was right. So in order to walk and stay on both feet and not fall, you need to have a lot of things working for you. Your vision has to be good. Your depth perception has to be good. Your vestibular system in your ear has to be working. You need to be able to feel things on the bottom of your feet. All of these change a bit as you get older. Balance gets a bit worse for everyone as they get older. Your center of gravity changes. You get shorter. Okay, sometimes we curve forward. And we're not able to get ourselves back up to an upright position as easily when we trip. We may not have the muscle strength that we had when we were younger. People who have cataracts, when the first cataract is removed, they're found to fall less often. There are many, many things that contribute to falling. Medications are a big one. There are several different things that together cause you to fall. And the good thing is you can tweak each one of these and decrease your chances of falling.
So what does good fall prevention work look like?
The first thing is what shoes you're wearing. Let's start there. Get rid of the stilettos. There's no place for them. You need a good base to be on as you get older. Second thing is to make sure your vision is as good as it can be. If you have bifocals or Verilux type lenses, don't wear them outside. Okay, they'll confuse you and you'll trip more easily. Go through your medications with your doctors. Ask them if any of these could be contributing to your falling and whether you really still need to be taking them. And if so, at what dose? Can you decrease the dose a bit? That may make it less likely that you'll fall. So there are many things like that you can do. And of course, exercise, walk, balance exercise. Those are really, really important. And strength exercises.
You know, we've had several medical guests in the past who've complained that medical students don't spend a lot of time on issues that affect older patients. And there are that many residencies and fellowships go unfilled every year because nobody wants to study geriatrics. But I know you teach medical students, and I wonder if they're receptive to knowing about the older patients' bodies. And I even wonder how, in your book, you talk a lot about how a body at 80 is different than a body at 60. If nobody's studying that, how does anybody figure that out? And how do they know what to do? And what can doctors do? And how can we help them?
So yes, it is true. There are fewer people going into geriatric medicine than there are spots to train them. Okay. And there are many reasons for that. One of the biggest ones is their age. They don't quite get older people when they're 25, 30, 32 and graduating. The second thing is that medical school has become ridiculously expensive. And these kids are leaving $250,000, $300,000 in debt. And so they're looking at specialties that pay a lot more. And the third thing, I think, so I'm going to switch from that and just talk about how do we make sure they know what they need to know. So we have worked for years with foundations doing things to put geriatrics into medical schools. And there's a lot more than there was, but there's still not enough. And so we've been doing all sorts of things. Our school has had a required 3 to 4 week rotation for every medical student in geriatrics since 1982 or 1983. We now, when they're with us, we do a course on ageism. So they understand how their unconscious bias affects the healthcare they're able to give to older adults. And I have the pleasure of being one of the older adults who talks to them about this. They really want to do the right thing. They need to be taught. You're absolutely right. And one of the reasons I wrote the book is I have had patients who come to me who feel blown off by their doctors. And, what do you expect? You're 80. And that's ridiculous. You need to make sure that there's not something going on that can be fixed or made better, regardless of what age somebody is. And if that's what your doctor is saying to you, you should talk back to them and say that's not an acceptable answer. Okay, what is going on with me? And let me tell you, they will learn. I put a lot of things in the book that I hope that people take to their doctors, in particular about medications, to make sure you're not taking too many or too much in terms of doses, because that's something we can fix by decreasing the doses and decreasing the medications and making people feel better.
We've talked about the normal 15-minute doctor appointment. It's hard to go through all that in your 15 minutes unless you're seeing a person who specializes in aging.
Right. And a person who specializes in aging usually does not have 15-minute visits. We have longer visits. My suggestion to patients is that they have 2 or 3 things they want to make sure they get answers to when they go in to see their doctor. And so that they focus it and realize they can come back.
I want to change the subject a little bit.
Sure.
We don't like to talk about it, but of course, aging brings changes in cognition. Can you explain that some of those might be normal and how we can adjust to them, and how we know if it's aging or if we should say, oh my God, it's dementia, and how can I tell the difference?
Right. So it's everybody's fear. Let's start there, is that they will develop dementia as they age. And for a certain percentage of people, they will. But everyone, as they age, has changes in their cognitive abilities. And some of these start when you're 30. So your ability to remember and memorize, learn lists of words starts decreasing when you're in your 30s. Your ability to do things under time pressure decreases. If you're given as much time as you need, you do much better. There is difficulty with doing calculations, thinking about roots, things like that in your head. It's much harder than it was when you were younger. Multitasking becomes much more difficult. I'm not somebody who believes that anybody can really multitask well, but as you get older, you'll do far better if you concentrate on one thing at a time. So these are just some of the changes that occur, okay? But the thing that everybody really worries about is their memory. And it's when they can't get a word or they can't remember something. And immediately the concern is, oh God, I'm having dementia. And the truth of the matter is, most of the time what's happening is somebody is having trouble with a noun in particular. They're looking at the screen, they're seeing the actor, and they're saying, well, there's old what's his name. And I just can't get the name. And we laugh, medically, we call this the tip of the tongue phenomena. If you are able to remember it at some point, or if somebody tells you what it is, and you can remember it a few days later, this is not dementia. This is what we call the senior moment, okay? And the problem, the dementia itself is for the most part a problem with storage. You have to store material in order to retrieve it and get it back out again. If you just can't get it back out again, it was stored, that's fine. If it was never stored, that's dementia, and that's a problem, okay? So that's one way to differentiate these a little bit.
Is there a way to forestall it?
The ways to forestall it seem to be taking really good care of yourself. There was a study that came out in, I think it was Lancet several years ago, called the finger study. I will never remember what all 7 things were that they came up with, but they're things like sleep, okay? Because you consolidate your memories at night when you sleep. So you've got to get good sleep. Vision is very important. Hearing is very important. If you don't hear it or see it, you cannot store it. Okay. So, everybody gets upset about hearing aids. Get over it. It really makes a difference in your life. exercise, and the exercise does not have to be something that makes you out of breath or hurts your muscles. It's just moving, doing. And socialization, which we learned a lot about during the pandemic, and I'm sure you've spoken about.
There's been so many changes in life expectancy in our lifetime in the last century or so. So does this make it easier for people to live longer? Or are there things that people need to do to help themselves live longer? I mean, can we prepare for 100-year life?
We can prepare. I can't promise you're going to get there, but we can prepare. Okay. I think, there was a 30-year increase in median life expectancy during the 20th century, which is extraordinary. I mean, that's so much more than at any other time in our existence. And it also explains why we as a society don't know quite what to do with all these older folks. Okay. We've never had this before. We've had isolated people who live to 85, 100, 122, but not this many. So I think probably the biggest thing you can do is prepare your mind. It's your perspective on aging that really probably has more impact than anything else on how well you're going to age. And there's a clinical psychologist at Yale, Becca Levy, and the studies she has done basically show that if you have a negative view of aging, you're not going to age well. And if you have a positive one, you'll live longer, you'll be able to do more. And it's a self-fulfilling prophecy. And that's so important to recognize. So I think we as a society need to get over it and really start looking at how lucky we are that we have these 20 to 40 years that we never had before. The kids are grown. We don't have to go to the office every day. You can do what you want and do meaningful things that you never before were able to do, instead of thinking of what you're losing, everything you're losing, because yes, you're going to lose some things. That's real.
I wanted to ask you about clinical trials on older people.
Mm-hmm.
We talked about how their bodies are different and everything.
Yeah.
Is anybody doing anything about that, changing that to see how, because you keep mentioning medications can be affecting other things. So please give us some good news about that.
I will, actually. So the medications that are out there, the vast majority of them were not tested in older people, even if older people are the ones primarily taking the medication. Okay. 2 reasons for that. One, it's a pain to be in a clinical trial, quite honestly. You have to keep going somewhere. You get labs done. You got to do these tests. There's a lot of stuff going on. So a lot of people just don't want to do it. But the second is that older people were disqualified from clinical trials if they had other problems going on, if they were taking certain other medications, if it was unlikely that they were going to live a certain amount of time, and many, many trials for many years just said only to 65. Then they went up a little, only to 70. Last year, the National Institutes of Health, who give out a lot of money for these drug trials, made it their policy that if you were to exclude any group of people and get their money, you had to explain to their satisfaction why. So suddenly, older people are going to start being in trials. Yeah.
So what's the good news we want to leave our listeners with?
I think the good news is that we have this unexpected benefit that people before us never had, that we really should start thinking about it, not the day that you retire, okay, but a ways before. What are some things that you'd really like to do? I tell people, what's the road not taken? And I think that's what we need to be doing. There are so many people in this world who could use what we know, the skills we have, our company. There's a lot that you can do, even if you're not having a full-time job, that can make you feel good about yourself in the world. So that's my last word.
Well, thank you so much for all this information and advice. Our guest was Dr. Rosanne Leipzig, author of Honest Aging, An Insider's Guide to the Second Half of Life.
Today on News You Can Use, we're talking about gratitude. Since we've just learned that many things affect how we feel as we age, a professor of psychology at UC Davis and an expert on gratitude studied more than 1,000 people who consistently practice gratitude. The professor, Robert Emmons, reports that he studied people who kept a gratitude journal and found that even 3 weeks of recording things for which they're grateful, these people ended up with lower blood pressure, took better care of their health, were less bothered by pain, and they exercised more. And these were just the physical rewards.
Psychologically, he found that the journal keepers had more optimism about life, seemed more alert, and showed more pleasure. Socially, they were more compassionate, forgiving, and felt less isolated. Professor Emmons looked behind his research and analyzed why he found the results he did. First, he writes, gratitude allows us to magnify positive emotions and allows us to participate more in life. We notice the positives more, says Emmons. This doesn't mean that life is perfect. It doesn't ignore complaints, burdens, and hassles. But when we look at life as a whole, gratitude encourages us to identify goodness in our life.
Emmons says that gratitude blocks toxic negative emotions, such as envy, resentment, and regret, emotions that destroy our happiness. There's even recent evidence that showing gratitude can reduce the frequency and duration of episodes of depression. There are a number of studies showing that in the face of suffering or adversity, if people have a grateful disposition, they'll recover more quickly. Gratitude gives people a perspective from which they can interpret negative life events without lasting anxiety.
But he warns us that gratitude is not always easy. Gratitude goes against our need to feel in control of our environment. Sometimes with gratitude, you just have to accept life as it is and be grateful for what you have.
And that's our podcast for today. Our thanks to our guest, Dr. Rosanne Leipzig, author of Honest Aging. You can learn more about Next Village SF at their website, nextvillagesf.org. Our theme music is from Hook Sounds, and Jason Dahlstedt is our engineer. And thank you for listening. We'd love to hear what you would like us to discover and discuss. Please contact us at notbornyesterdaypodcast.org and follow us on Facebook and Instagram and subscribe wherever you listen to our podcasts. All of these are free, and they'll help us know our audience better. Be well, stay strong, and remember, you weren't born yesterday. I'm Lynn Winter Gross.
And I'm Miriam Goodman.